All right, welcome back to The Explainer. Today, we're diving straight into an incredibly fast-moving, really important situation that health officials all around the world are watching like a hawk right now. As focused learners, I know you appreciate just cutting through all the noise and getting straight to the mechanics of what is actually happening on a global scale. So today, we are breaking down the latest critical global health alert regarding Ebola. We're going to look at the raw data, the historical context, and honestly, the incredible science behind the global response. To make sure we cover all this efficiently, here's our roadmap for today. 1. The highest global health alert. 2. Understanding the Ebola virus. 3. Learning from past outbreaks. And 4. The strategy to fight back. Okay, Section 1, the highest global health alert. Let's dive right into the breaking situation unfolding in the Democratic Republic of Congo and Uganda. So, to really grasp how serious this situation is, we first have to talk about the acronym PHEIC. That stands for a Public Health Emergency of International Concern. The World Health Organization has officially issued this declaration. And look, it's absolutely crucial to note that this is their highest possible global health alert. They do not issue this lightly. This alarm was triggered specifically because several laboratory-confirmed cases, along with some suspected cases and tragically multiple deaths, have recently been reported in affected areas of eastern Congo and Uganda. It is a giant flare going up, signaling to the entire international community that immediate, coordinated action is required. Now, precision really matters when we're talking about virology, right? This current crisis is linked directly to one very specific type of the virus, the Bundabugo Ebola virus strain. Ebola isn't just one monolithic thing. It actually has several different strains. Identifying the specific strain, like Bundabugo, is a critical first step because it dictates exactly which vaccines and treatments are actually going to be effective out there on the ground. Moving on to Section 2, understanding the Ebola virus. Because to truly understand why this WHO alert is at the absolute maximum, we need to look at the mechanics of the virus itself. At its core, Ebola is a severe and, sadly, often deadly zoonotic disease. As you can see from the bilingual terminology here, zoonotic simply means it's a disease that makes the biological leap from animals into the human population. Understanding this exact origin point is absolutely fundamental if we want to understand how these outbreaks spark in the first place. Think of it kind of like a chain reaction. Step 1. The virus naturally resides in wild animals in the region. We're primarily talking about fruit bats and primates here. Step 2 is that zoonotic event we literally just defined. The virus makes the jump from these animals over to a human host, usually through hunting or just close contact with the natural environment. But it's step 3 that actually triggers a global health alert, human-to-human transmission. Because once the virus enters the human population, the mechanics of the whole outbreak shift entirely. So once an outbreak gets going, how does it spread? Well, unlike airborne viruses that can basically cross a crowded room just from a sneeze, Ebola requires really intimate exposure. It spreads through direct contact with infected blood, contact with body fluids, or even by touching contaminated surfaces. And here's a crazy detail for you. The virus can actually survive on surfaces, like bed sheets or medical equipment, for several days if the conditions are right. Now, while this means it doesn't spread as easily as, say, the flu, the sheer severity of the illness makes every single point of contact incredibly dangerous. That's exactly why healthcare workers and family members of the sick are always at the highest risk. All right, Section 3, learning from past outbreaks. The good news is we are not fighting this battle entirely in the dark. History gives us a ton of crucial context for today's emergency. If we zoom out and look at the timeline of our fight against this disease, you'll notice Ebola is definitely not a new adversary. The very first outbreaks were documented all the way back in 1976. However, the absolute turning point for modern public health was undoubtedly the 2014 to 2016 outbreak in West Africa. That was, by far, the deadliest outbreak in history, and it severely tested the limits of our international medical response. And that brings us right up to the present day, where this new public health emergency of international concern has been declared. And this starkly illustrates the huge contrast between the past and the present. You see, the immense tragedy of that massive West Africa outbreak, it acted as an urgent catalyst. It pushed the entire world to dramatically ramp up vaccine research and develop completely new treatments. The result? In the current outbreak, we aren't helpless. Vaccines and monoclonal antibody treatments, which basically work by binding right to the surface proteins of the virus to neutralize it, are actively available right now. They are being used on the ground as we speak to reduce deaths. The science has literally caught up to the threat in a very, very real way. Which brings us to Section 4, the strategy to fight back.
Let's see how health officials are actively mobilizing all these new tools out there in the real world.
The WHO is currently executing a massive, multi-pronged tactical response, mostly because a single tool just won't stop a virus like this. You need the whole shebang. First up, rapid isolation of the sick to instantly cut off transmission. Second, supportive medical care to keep patients alive and fighting while their bodies process the virus. Third, meticulous contact tracing, literally tracking down every single person an infected individual has interacted with. Fourth, deploying those amazing new vaccines to create a ring of immunity. And finally, ensuring safe burials, because, incredibly, the virus remains highly transmissible even after a patient has passed away. But here's the catch, and this is absolutely crucial. Medicine alone isn't enough. You can have the best vaccines in the world, but if people are too terrified to actually go to a clinic, the virus is going to keep spreading, period. That's why health officials are working so incredibly hard on the human element. The social strategy is literally just as vital as the clinical one. They're actively working to build public trust, completely reduce the stigma associated with the disease, and encourage people to get treatment early, which is exactly when those monoclonal antibodies are the most effective. So if we had to boil down the core takeaway of this entire explainer, it's that successfully controlling an Ebola outbreak, or really any major zoonotic outbreak for that matter, depends entirely on balancing 4 key pillars. You've got the hard medical science on one side, with aggressive disease surveillance and rapid vaccination. But that has to be perfectly paired with the human element on the other side, strict infection prevention protocols and deeply rooted community awareness. Honestly, one just cannot succeed without the other. Which leaves us with this. We've looked at the current emergency, the fascinating biology of the virus, the dark history of past outbreaks, and those incredible modern tools we now use to fight back. So I want to leave you with a massive question to ponder. Armed with these brand new vaccines, advanced monoclonal treatments, and vastly better global surveillance networks, is the world finally ready to stop future outbreaks before they even start? Have we actually learned enough to stay one step ahead of the next zoonotic leap? Thank you so much for joining me for this explainer. Stay curious, stay focused, and I'll see you next time.